Welcome to week 7 Claw. This is the one where we spotlight something basically. So, we actually get this introduction done right for once in my life, huh? Welcome to Claw. This is the cool lifestyle and wellness. This is the part of the week where I put a spotlight on something that's helped me in my journey. This could be a product, this could be an app, this could be a YouTube creator, it could be a whole program. That any of these things that if it made my life easier, healthier, and kept me from spiraling into a full gremlin mode, it goes into the claw. Just let you know anything that is within this claw, or most of the things, is not sponsored. If it ends up ever being, I'll let you know. But I'm going to tell you whether or not I was sponsored. To be perfectly honest, I'm going to tell you exactly what I think about it, whether it's good, whether it's bad. Most of the things have been good so far, because they are good, but I'll let you know if something's off. We'll talk about this ring one of these days, okay? Anyway, this week though, now we're off subject, we're talking about something that saved my tail more than I can count, and that is Doctor on Demand. Now, Doctor on Demand, this one's gonna be a little bit different than the other programs I talked about. Usually the other programs are like weight loss or your like my blood pressure cuff. We'll talk about the glucose one, and these are things which a lot of them, like, sometimes I'm not too sure, like, if you have to have insurance or anything else like that. Doctor on Demand, it is basically something that you don't have to have insurance for. Now, granted, it's going to depend on whether or not you have insurance, depend on your insurance, on how much it costs. But anyway, Doctor on Demand. What it is, it's a virtual healthcare platform. Again, like I said, anyone can use it, whether or not you got insurance. Now, insurance may reduce your cost or may even make it free. You do want to make sure that for y'all with insurance, well, if you don't have insurance, it should show you the cost, I think. Check it out. Those of you with insurance, do make sure you check with your plan. If you are lucky enough like me, anything that is a virtual visit, which these are all virtual visits, I have no copay. So hopefully your insurance does the same. Now, just to let you know, Doctor on Demand is not emergency care. And to clarify, everything that I'm going to let you know here is not medical advice. This is just my experience. Okay? Basically, Doctor on Demand is basically an urgent care therapy, and sometimes it can actually be primary care. We'll go over that in a little bit. But it's going to be all that on your couch. No waiting and no one. I can talk today. Look at this. But basically, no waiting room, no fluorescent lights, no coughing toddler licking the chair next to you. Okay? That's the basics. So we're going to break this down because there's a few different things that this thing can have. First of all, we're going to talk about the urgent care. So what they can help with on the Doctor on Demand is things like if you have a cold, a flu, an infection, you have a stomach bug, you have a rash, you need a medication refill when appropriate. Just let you know they can't do the what they call the scheduled drugs thing, but you know what I mean. They can give you work notes. They can, and just basically any general not emergency things can help you in the urgent room. This means that they can't help you with broken bones, trauma, like to the head, if something hits you. Anything that needs imaging or like actual emergencies. So, basically what I've used this part for, the urgent care, is I'm sick for 3 or more days. If your job is like mine, and like most jobs, sick for 3 or more days means you are required to have a doctor's note. So what do? I just go click. I see a doctor in 10 minutes. Get my doctor's note. It is a roll of the dice doctor. It's just like urgent care if you went into an actual building. But you get what you need without ever having to leave your home. Which is good because it also means you don't get other people sick. You just stay in your home. Alright? So if you're sick of the dog and you've been horizontal for 3 days, this is perfect. If you broke your leg, no. Go to an urgent care. Like actual urgent care. Please don't show your broken leg to your webcam. Okay? Third section I want to talk about on this is the mental health options. Now this is the hardest segment because this is the main thing I use it for. I do use the urgent care occasionally to get, and usually I use it whenever I'm like I didn't use it this sick because I got better. But if it had been another day, because I'm stubborn and don't see people when I should right away. Anyway, if it had, I would have gone to them, gotten some medication, because at that point my body's like, I'm just here going, okay, so please something make this better. And of course I'd have to get a doctor's note. And do I feel like getting in a car? That already freaks me out. And going, no. And then for me, it's a $40 copay. No. I'm sick. I'm going to click a button and be done with that. So, but here's the thing, I use it. I actually use Dr. Allman all the time for this specific option. And this is basically the mental health. Now you can see a psychologist. A psychologist are the ones that does basically talk therapy. They cannot prescribe medications. Or you can see a psychiatrist. A psychiatrist are the ones that do medication management. I'm going to give you my personal philosophy. This is me. This is what I believe in. You may believe in something different. Doesn't mean you're wrong. Doesn't mean I'm wrong. But this is how I feel and suggest and would give advice to personally to anybody, is to talk first. Basically see a psychologist first. By doing this, you're going to build some trust. You let someone get to know you before anybody even mentions medications. And if medications ever do become necessary, you want that recommendation coming from someone that actually understands what you're going through with your brain, your patterns, your history, and not just from somebody that's only seen you for like 5 minutes. Okay? That's my own personal thought on that. But again, now, look, I could show you, like I said, I see my therapist on this. I see her once a month, normally, sometimes more, but most of the time once a month for 50 minutes. And I wish I could show you her biography that I had saw, and I really do, because I do remember scrolling through the list, because that's how you pick them. Like on this one, you scroll through this little list and you look at these little bios, and I was reading her little blurb, and I went, yeah, that's her. And it was instant, and the vibe was immaculate. And somehow, by some miracle, that vibe was real. First try, perfect match. I got lucky. However, I'm not going to share her blurb for 2 reasons. Number 1, it means I have to go look for it, and I'm not chancing anything that could possibly mess with my connection to her. I am good with technology, but I don't always trust it. And I'm not risking anything, clicking the wrong thing and suddenly losing access to my therapist. No, thank you. And I gotta call somebody. We gotta figure that out. Second reason, privacy. I do share a lot with you, and you know that. But as for her identity and her biography, that's gonna stay private. It's just respect. And who knows, maybe someday you'll be deciding to use this. You can go through and you're gonna see her bio, and you are gonna pick her. But that does need to be you doing it. So we're not gonna do that. But, as we said, basically, whenever you do go to pick out a psychologist, and I'm going to guess when picking out a psychiatrist, it kind of does the same thing. You go through these bios that are basically ones that you can do. So, like, when you live in a certain state, they do have to be licensed in that state. So it should show you it should ask you where you live, and it should show you the bios of where you live. So you're going to browse through them, you read them. You're going to read them, you're going to pick who feels what's right. Like, I think I remember something about mine said she likes to play video games. I am a gamer. I would like to talk to somebody that likes to play video games. Yes, because they're going to understand my mindset, and she does. And then, got lucky, she's from what I can tell, about my age. Younger, probably. But, just, there was more to it, too. That was just the main thing I remembered. I was like, ooh, gamer. And I think I saw something about pets. Ooh, pets. And I went, ooh, that's me. Yeah, it just ended up being right. So yeah, just look through those bios. But basically, when pick somebody finds what's right, you can either schedule, I believe, a 30-minute or a 50-minute. And you can see them regularly, see the same psychologist for however often you like, as long as there's an appointment available. As always, I always tell people, if they end up not being a good fit, switch. There's no guilt and no shame to it. Okay? As I said before, my suggestion, start with a psychologist, talk with them first, let them help you untangle things. If they think that you need a psychiatrist, they should tell you, and you can book one if you do need a psychiatrist right there in the same app. Okay. 1 second. I'm going to share something. I may have shared this before. I don't know. But I don't like medications unless they're absolutely necessary. Now, I have had depressive episodes before. I had a lot before, especially before this journey. I had some really, really, really bad ones, and they could last. And I'm not just talking about like the few years that I saw my therapist. I'm talking about for like 20 plus years of this back and forth thing. So my therapist has gone through a few of those with me. There has been a few times that she suggested maybe I should see a psychiatrist for the depressive medications. But we talked it out. We decided to wait. I would just make the soonest appointment, see how things went. She gave me some things to try. And so far, at least from there, it's kind of worked out for me to where, just those little episodes went away most of the time. Or mostly, not most of the time, mostly. But to be perfectly honest, if she ever basically put her foot down and say, no, really, I think you need to, I think it's time, I would listen to her. I've seen her for that long, and I trust her that much where I'd go, okay, fine. But again, we both are the understanding of, unless it's absolutely necessary, please no. Anyway. My final guidance, again, this is my suggestion to you, this is my advice. When you do go to see a psychologist, though, you do want to make sure you go in with your symptoms. Let them know, this is how I feel, this is this. But don't go in with your self-diagnosis. I know we all love Google and WebMD. I've looked up plenty of things myself. But just like my Calico, my little co-pilot, my little AI, trust but verify. They are trained in this stuff. Let them help you detangle your mental knots. So that's for the mental health portion. I highly suggest it. I really do. If you feel like you need to see a mental health professional, they're licensed. You can go through, you can find the one that is just right for you. And like I said, you don't have to go into that sit and waiting room or whatever. You can just do it from, just make sure your phone is charged and make sure they can see you and make sure they can hear you. That's about it, because it's a virtual visit. So the next thing we're going to talk about is a primary care. This is something else you might be able to get as well. It does offer you can get a primary care provider in many states. As the other one, insurance coverage does vary. If mine covered it, because it's a virtual visit, there would be no copay. Does mine cover a primary care doctor? No. But that's okay. I have a great primary care. I just don't like the, copay I have to pay because I actually have to see them in person. That's fine. I don't care. At least I can see them for urgent care and all the other stuff. But do check, because if your insurance covers it and you feel it'd be better for you, you can get that primary care through that, depending on that. Or if your insurance doesn't cover it, it might just cost you some money. But it does exist, and for some people, it's a great option. Some plans let you use doctor on demand as your primary care doctor. Again, mine does not. Mine said, no ma'am, you can have an urgent care and therapy, and that's it. But if yours does, it might be worth looking into. So, why did this make it into Claw this week? So we've been going on about the mental health journeys and learn to live and stuff like that. And so I figured this would be a good one to go through, especially if you need to, sometimes it's like you do want to see your primary care before you do certain exercises, before you take certain medications. And of course, if you get sick and you need to see a doctor and stuff like that. So I figured this would be, since we landed on the week that we went through, that I wanted to do the programs, I figured this would be a good week to do the doctor on demand before I start going into like the weight loss and stuff like that programs. And one reason I love it is there's the convenience of it, the accessibility of it. There's no waiting rooms, there's no travel, there's no exposure to germs for you or the other person. There's mental health support that can fit your life. See urgent care without leaving your home. I have a therapist that has been with me through basically everything, through this journey, before this journey. And this is a tool that generally supports my wellness journey. This app has been a great part of my wellness toolkit for years. It's been here through the chaos. It's been here through the Calico journey. It's been through the Goblin Truck sickness weeks. It's been there. Okay, so from here, we just want to talk about, just really quick go over, just remember, therapy is normal. Getting help is normal. You deserve support. You deserve a therapist that fits you. You deserve care that's accessible. You deserve to feel better. And you deserve tools that make your life easier. If you try, and again, as always, this goes for a primary care, this goes for a psychologist, for a psychiatrist, even if it's not on this app, even if it's in person. If you try somebody and it does not fit you, you do not feel comfortable, you do not feel like it's right, that is not you failing. That's just basically dating, but for your brain and your body. Okay? Just keep going until you find the right one. Feel okay to change if you need to try somebody else. It's okay. There's somebody out there for everybody. You'll find that doctor eventually. I mean, my doctor took me, 20 years? But I found one. Not in this app because I can't get a primary care. But I did find a doctor after many years of trying, but I did finally find one. If I could find a doctor, I believe you can too. Alright? So, let's see here. So that's why Doctor on Demand is in the claw this week. It's helped me stay on track. It's helped me stay sane. It's helped me stay supported. And I hope if you try it, that it helps you too. So if this helped you or gave you something to think about, go ahead and like, comment, subscribe, share it with someone who might need it. We're all figuring this out together, one tiny cat step at a time. Okay, see you next week.